So, good morning, Anne. Thank you so much for joining me today. I'm so grateful that you took the time to share your story.
No
Um,
worries at all. Yes, my pleasure. Thank you for having me.
of course. Um, so, Anne, we share something in common. We have both had a thyroid rupture, and I was just hoping that today we could interview you and go through your entire experience. If you'd be willing to share, everything that you went through, all of it, whatever you feel comfortable with. I would love that. Is that okay?
Yeah, absolutely.
Awesome.
Anything I could do to help because I know, like I told you before, to stay in the dark without any help at all is really, really scary. So yeah,
Yeah.
let's do this.
And I think that's why, I started doing all of this too
Mm,
and interviewing patients is because, we both share the experience of not having a lot of resources available to us
yeah, yeah.
when going through this complication. And so anything that we can do to share our stories and answer questions. Of course, we're not doctors, little disclaimer, we can't give any medical advice, but, we can share what we went through and what
Mm.
was helpful for us, for other patients. So thank you.
Okay.
Yeah.
No worries.
So do you want to just start off just giving us some like general demographics? Because some physicians might watch this too, and sometimes they find it helpful to know where you're located because procedures might be a
Mm.
little bit different and your age and all that good stuff. Do you feel comfortable sharing
Yes.
that?
Yes. Okay. So I'm 35 and I live in Ireland. Originally came from Thailand and I'm half Thai German, so basically mixed race. I'm not too sure if that's help at all, but it's good to know anyway. So since 2009, I found out that I have a lot of cysts, smaller cysts and nodules. M- All of them is benign and cold, so not active, basically. So I haven't been on any medication at all, and I've checked bloods regularly, nearly every year, and everything came back normal. And basically, oh, the big cysts, I think the biggest one was about like 4 or 5 centimeters, but we drained it from time to time, so it's shrank until it's barely there anymore, so it's not a concern. And then on the right lobe, I had like two nodules which kept growing, and then by that time they combined into one big one, and it kept growing until I think 2016, I had the ethno injection, just tried to reduce it, but it didn't help at all because by that time I think it was like 6, 7 centimeters wide. And then I moved to England to do my master's degree. By that time, I kind of forgot about everything, just like, head on to the study and then didn't eventually forgot about it eventually. And I didn't look after it, didn't follow up until I moved to Ireland in 2020. And then later on, a few years later, got pregnant. Then after the pregnancy, for some reason, maybe I was just imagining it, but I felt like it got even bigger and quite, not rapidly, but bigger, faster than before.
Okay.
And it's very obvious, and I was very aware of it. Like, it's not even for somebody when you swallow, you can only see when you swallow. But for me, it's very obvious that I have something on my neck. It was like over 8 centimeters long. I'm not sure about the rest of the length. Maybe it's 8 by 6 by something, and was benign still and still cold. There's no other symptoms, no no, I didn't have any difficulties following, eating, breathing. It was all fine. It's purely cosmetic. That's why I kind of like, I'm not going to do surgery. That's not for me. And I can't be having like to take pill for the rest of my life is not a choice for me. So I tried to find search the internet everywhere what
Mm.
to do without the surgery. So I found actually RFA is the only one. It's actually I found this treatment before I found Jen's group,
Oh,
Facebook
really?
group.
Okay.
And I did RFA once before I joined the group. So my first RFA was so last year, 2024, in late March. And then everything went so well. And then it shrank down to like more than 62%, which is massive reduction. And I was really happy at the time. And then because we did the check, just by the way, this treatment is not available in Ireland, so I had to fly to Berlin in Germany to do it. My doctor is like is he's the kindest, nicest man. And then he was just going through every single thing. And then he would just keep asking me, oh, do you feel too hot? Shall I stop? Or like, he really, I felt really looked after and relaxed during the whole thing. So I had a really great experience during the first time and kept like shrank and shrank. And then I was just thinking, oh, should I do it again just to shrink it further? So I asked my doctor, and then he said, oh yeah, from his experience, the second time around is more effective even. So okay, I'll do it again. So that was January this year, 2025. And then everything went normal again, just like how I had it the first time, the recovery. And then 2 months after, I started to notice that, oh, it's not shrinking further. And sometimes I could even feel it's becoming a little bit bigger. So just remembering, thinking I was a little bit annoyed actually. Oh, I just paid a lot of money and it's not shrinking.
Yeah.
So, and then 1 week after, I think it was on the 23rd of March this year, so around 2 months after the treatment, the second one, I had this kind of sudden neck swelling, and then there's no pain or anything like that. It's just I just noticed I could see it clearly that it got bigger and a slight pressure within my neck. So I went to an ER in Ireland, which is A&E, and then they scanned my neck and then did the blood test and everything, and they couldn't find anything apart from the fact that the ablated nodule looked bigger. And I saw the scan results myself, and there's no ruptured area that I can see at all. So for them, they were like, we have no idea how to treat you because it looks normal. And so I went back home like, oh no, what's going on? Um, and then I kind of at a time, I think I post on the Jen's group as well, asking for advice, really, if there's any symptoms I should be aware of. And then I did my research as well, going through all the posts from everyone who's got ruptured nodules, and all of them's got like red neck and pain and had to be on pain medication every now and then. I didn't have any of that. So I was just thinking, oh, well, was mine ruptured? Then I wasn't sure until 2 weeks after that my neck become red and inflamed, and then the burning sensation came through. That's when I know, oh, it's ruptured.
Mhm.
And so yeah, that's the point that I kind of went back to the hospital here in Ireland. And then the doctors kind of shocked really because they had no idea how to treat this because obviously the treatment is not available in Ireland. So they're not familiar with aftermath of all of this, basically. So they thought, oh, it looks infected. They asked for the chest scan, and I had to stay at the hospital for 2 nights, which I think in the end is not necessary, in my opinion. I could have done it like, as an outpatient because for myself anyway, when I stay at hospital, I couldn't sleep properly. So
Yeah.
I ended up for 2 nights, nearly three days, feeling really exhausted coming back home. Whereas you should have proper rest when you have the rupture. I feel like my body just need the rest. But I didn't get it at hospital at the worst week of the rupture as well, which is like, but well, everything went fine in the end. And so when I was at the hospital, we had a scan again, ultrasound scan. I declined CT because I can see it clearly from the ultrasound already that's ruptured. There's no point to do another scan. And I knew for sure that was ruptured. And I even emailed my RFA doctor in Germany as well. And then he said, that's definitely ruptured. And he kept telling me, don't let them do surgery, don't let them intervene, just let it be. And then I was just trying my best, try to convince everybody in Ireland, in the hospital in Dublin, just to say, like, listen to my doctor, this is it. We just need to observe and yeah, and look after it because it's going to be a long healing process. And so at the end, me and my doctor here in Ireland, we kind of collaborate. I sent her my diary because I've been taking pictures of myself of the neck every week from then until now, and I'll keep doing it until it's resolved, until my neck looks normal, basically. And because she is doing medical talks as well from time to time, so it'd be nice for everybody to be more aware of the after effect of RFA. Even though it's rare, it seems like quite a lot of people's getting it. Maybe because it's Jen's group is very specific
Yeah.
group, so we see a lot of cases then, but maybe outside world is not very aware of what's going on yet. So yeah, as much information as we can take really and spread it out to everybody, the better.
Yeah, absolutely. Wow. So, so I want to ask you a couple questions about the physician. So you have your RFA physician in Berlin, Germany, who actually did the procedure, and you were in communication with him back and forth throughout this process, correct? And so,
Yes,
okay.
yeah, yeah. So, but it's not very often because during my first treatment, I only sent him my scan results at the third month and 6 month post treatment, and that's it. That's the basic follow-up.
Mhm.
But this year is different. So I could have emailed him most often during the first few weeks of Rupture, and then he was just guiding me nearly every day, like yourself as well, what to do and stuff. And it was really comforting to have him and you at the same time. Yeah, yeah, just to for me to stay sane, I
Yeah.
think, at
Yeah.
that time.
Yeah.
But right now, for the past few months, I haven't really talked to him yet. I plan to send him the whole thing, my
Okay.
results, the image of everything,
Okay.
at the end.
Perfect. So then your doctor here that you've been coordinating with, that's an endocrinologist, correct? So
Yes, yes,
okay, so
yeah.
the two physicians, there's a radiologist in Berlin who did the procedure,
Hmm.
the RFA
Hmm.
procedure. Then you
Yeah,
have the endocrinologist here, and she's the one who is kind of coordinating your care as far as the
yeah,
ultrasound,
yeah,
and then also you, the hospital treatment after it was ruptured.
yes,
Okay.
yeah, yeah.
And we met. So I just want to side tangent for just a second. I didn't introduce how we know each other. So, so we know each other through Jen's Facebook group. So there's this incredible woman named Jen, and she started this basically like this resource hub and support network for patients who are wanting non-surgical thyroid solutions. So if you found this and you don't know about Jen yet, I would highly recommend checking out her website, which is saveyourthyroid.org. And then she has a Facebook group where patients can post their stories, ask questions, really collaborate as a community. And so, because I had shared my story in that Facebook group about going through a couple of ruptures, she had asked me to kind of be the in-house expert on thyroid ruptures because I knew so much about them that then she introduced me to you when you were
Mm,
on the brink of going through the rupture. So I want to get the timeline right. So you had said that you had some symptoms and
mm,
then you went to the doctor. They basically were like, no, you're not ruptured. You had the ultrasound.
yeah.
2 weeks later,
Mm,
that you had more symptoms, wound up going back. Is that right? And did we,
yeah.
in the middle of those 2 weeks, when did you and I connect?
I think it was early April. I think going towards the second week of April,
Okay.
that's when I kind of it was a day or two before I went into the hospital. So yeah, I stayed
Yeah.
at the hospital, I think from the 9th until 12th.
Okay.
Yeah, something like that. But we met just a few days before.
Yeah.
And then at that point, my neck is not draining yet. You know, the fluid is not draining. And then because I sent you the picture as well, and then you said, oh, in the next few days, it might just pop. And then it popped straight away the morning after, which is like
Yeah.
a huge relief of pain and pressure when it does leak on its own and stuff.
Yeah.
So,
Yeah.
yeah.
And when that happens, so for other patients that go through this, one of the things that I noticed was that there's a lot of pain and pressure right before it breaks through the
Mm,
skin. But
Mhm.
then once there's a breakthrough, and that's not all, that doesn't always happen with ruptures, but if it does, once it breaks through, the pain kind of like subsided and it was really bad in those like 24, 40 hours leading up to
Mm.
through the process. Is that what you experienced too?
Yes, yes, exactly that. And to make it worse, what one of the doctors, one of the surgeon that my endocrinologist asked for advice, he came to visit, and then he maybe unknowingly, because I'm sure he's not familiar with this type of complications. He pressed my neck quite hard on the inflamed area, unfortunately. And it was surprisingly to me, it's not that painful, but I didn't stop him either. Thinking back, I should just say, could you stop maybe? Because it's nearly a minute of pressing on that area,
Yeah.
which in the end, my RFA doctor said, oh, that doesn't help. You should have just leave it alone.
Yeah.
Nobody should be touching your neck like that.
Yeah.
And I ended up telling my endocrinologist like this happened, and then she said, "It's good that you're telling me it's not going to happen again. Thank you so much for letting me know
Mhm.
and everything." So that was really nice actually. So we, in a way, I feel like we're still learning together, really.
Yeah.
And it's very good that my doctor here in Ireland, she's really kind, super nice, and really patient with me. And then she's really supportive of what we're going through, and then she's willing to learn with us as well, which is nice.
Oh, that's beautiful. Yeah, I love that. And I love that when you told your physician what had happened, that she was saying, that's not going to happen again and was willing to like kind of like implement some process improvement, which I think is so
Yeah.
important because it's so, like you said, it's not common. And I would love to hear some of your thoughts about what it was like doing RFA out of country, because I know there are a lot of other patients that are in countries where they don't offer RFA, they go
Mm.
elsewhere, and then they want, if they were to wind up having a rupture, how to best handle that. Like, what are your thoughts on that? Do you have any recommendations, any concerns?
Um, Well, I would say just if you're starting to have the symptoms straight away, just email your RFA doctor because he or she would be familiar with, like, rather than going to somebody in your country where you don't have the treatment because they would not know as much as the RFA doctor
Right.
knows about all of this, so he or she would be able to guide you through what's the next step we should be doing, which most likely is going to be observation
Yeah,
because from the research that we read through Christina, nearly all of them said no intervention should be prioritized unless it's really necessary. So
yeah,
I think, yeah, I think that's that. But I think flying to another country is not a problem for me. Well, Ireland and Germany is only 2 hours away, so it's not too bad, really.
yeah.
And I think I flew back a day after I got the treatment as well. My RFA doctor in Berlin, he was like, "Oh, when do you fly back?" And then I told him the day after. Initially, he was a little bit worried about the pressure in the plane, like flying right away. But then I was fine, like, so by the way, I don't think that caused the rupture because the first time just it
Okay.
was without complications, so that's not the point, flying right after the treatment. But however, I think you shouldn't fly on the day that you have the treatment
Yeah.
because it's very swollen, so you have to have a proper rest at least maybe 24 hours, I would say.
Yeah. So one of the themes I'm hearing from you and I've experienced myself too is just the importance of patient advocacy, right? It's
Mm,
like advocating for ourselves not only in finding the treatment that is good for us that meets our goals and our desires because
yeah,
most doctors don't know about RFA.
yeah,
Like most endocrinologists,
yeah,
I my endocrinologist
yes,
didn't
yes,
found it and
yes, completely.
yeah, so
Completely.
oh go ahead. Go ahead.
Oh, sorry, sorry. Because a lot I've consulted many, many doctors in Thailand and in England and in Ireland. All of them said surgery, surgery. That's your only choice. Either just keep it like this, so your neck will look like this, and keep growing, or have surgery. And then I was like, no, I'm not having any of that.
Yes.
And I was so. lucky and happy to find another alternatives and such a nice support group as well. So yeah, it is really despite everything that's happened, like the rupture, months of healing, I would still really like I would do it again, RFA. It's really, really safe and I feel really saved doing it. So
Good, good. So that's good to hear that even after a rupture, you would still do RFA.
mm, yeah,
That's
yeah,
Yeah, me too.
yeah.
So yeah, so it's a complication. It's definitely frustrating and scary and annoying and all
Mm,
the rest, but
mm,
it's definitely, I think, worth it in the long run, even with the complication. At least that's been my experience, and it's good to hear that that was yours too. But I
yeah.
think just that theme of patient advocacy, of really advocating not only for the procedure, but then also throughout the process. And that's why I was so glad that we were able to connect before you went to the hospital. I remember we
Mm,
messaged back and forth that whole weekend.
yeah, yeah,
Over the
yeah,
week, or I forget which day it was, but yeah, just going back and forth and being able to, ask questions, because it's just there's so many people that are not familiar with this. And from a patient perspective, when you're having a physical complication in your body and something's wrong and you're in pain and it's scary,
yeah.
and then you go to the doctors and the doctors don't know what to do, or they give you recommendations that are maybe not the
Yeah.
best recommendations, even though they're trying. I think that the
Mm,
doctors are
mm,
always trying to help, but
yeah.
sometimes they just don't know that information. They don't have the information to give you what you really need. So just being able to advocate for yourself, I think, is just so important. And so now that you've gone through this whole process, is there anything that you would recommend to other patients as far as that patient advocacy? Like, what was most helpful with that, or how could you step into that more? Do you have any thoughts?
Um, well, I think you just first of all try not to panic because
Yeah.
I know it's very scary in the first 2 weeks. But I remember thinking when I was about to go to bed one night, thinking, oh, if it kept swallowing, sorry, swelling, and then I wouldn't be able to breathe. That was one night I feel like, oh my God, what if that happened? But again, it's very rare because most of the rupture types that I learned, it's occurring outwards and not inwards into your neck. So I would say if you still feel like it's pressing against your neck too much, straight away ER and doctor will be able to help you. And I would say, well, for my case, because the first time that I went to the doctor and then they didn't see anything, I kind of like, okay. I didn't know what to do then because they didn't know what to do with me either. So I kind of like, I kind of know what's going on. So I was thinking to myself, okay, I just need to wait then because there's no other choice really.
Yeah. Yeah.
And until the symptoms arrived, then I was they could see for sure that something's wrong, and then they just went on from there. And then I was lucky in my part that the doctors here, and then yourself and RFA doctor in Germany, they all of you listened to me, and then we kind of worked together. I think I felt heard as well, not being like dismissed or ignored or anything like that. So it's very good. It's combination of lots of things really, but to advocate yourself, I think if you feel like you misdiagnosed or like not treated properly, maybe do research yourself and reach out to us, reach out to you, reach out to the group. And there's a lot of people who experience the same thing, but it's just not in your area. That's all. Just try to reach out as much as you can, but
Yeah.
at the same time, not overwhelming yourself with information because I know internet these days you can just read whatever and then you just ended up being scared. Like,
Yeah.
if but I would say if you think you have a rupture, you'll be fine. It's just scary at the beginning, but just like we both can say it to you now that that would be fine. It just takes time. That's all.
Yeah, it does take
Yeah.
time, a lot longer than I think a lot of people think. But yeah, being patient with the process, I think, is helpful.
Yeah.
Just
Yeah.
love the gut check. If it doesn't feel good in your gut and you don't feel peace,
Yeah,
what the
yeah,
doctor
yeah.
is doing, like,
Yeah, 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 yeah.
just
That's it. That's it. Yeah,
uh,
you absolutely correct. If
yeah,
you feel like your healthcare provider is n not going the direction that you think is the right way, just go somewhere else, really.
Yeah.
And that's it. Yeah.
Yeah. Okay, that's so helpful. I'm wondering if we can backtrack for just a second. I want to talk about all of your different symptoms. So that's something that people have difficulty with because there are some common threads as far as the symptoms, but then there are
Yeah.
some things that are different that some people have and then other. And I think that there are some symptoms that other people have that you may not have had. And so yeah, I just wanted to talk with you. So what kind of symptoms did you notice? Everything from pain to night sweats
Mm.
to
Oh yes.
yeah, like
Yeah,
all
yeah.
of it. Give me all of it
Yes,
for all of your symptoms.
yes, yeah, yeah. So, like I said, first week is no symptom at all, apart from the fact that my neck looked bigger
Mhm.
and pressure within my neck, no pain, nothing, no medication. But the two weeks after, when my neck's starting to turn pink, and then that's when the burning sensation came through. For the person, yes.
I'm sorry, is this after you ruptured or after procedure? Because you
Oh,
went a
sorry.
couple of months. So
Yeah, this is after it's ruptured. So, well, I'm gonna tell you the timeline. So, when I did the RFA, all the tightness and swollenness and stuff, it's gone down within a day or two. So I didn't feel like my neck was pressed or is there any extra pressure. So
uh-huh.
it keeps shrinking and shrinking until uh between a month and a half to 2 months, it's kind of stopped shrinking.
Okay.
And then I didn't notice anything then, but I kind of a little bit annoyed really that it didn't
Yeah.
shrink as much as I thought it would be for the second time treatment.
So everything was totally normal for the first month and a half,
Yeah, yeah, yeah,
right?
a month and a
Okay.
half to 2 months. It was totally painless and nothing, everything was recovering as it should be, just like
Hmm.
the first time. And then, yeah, 2 weeks after, when it becomes a little bit pink and red, my neck, that's when the burning sensation came through. And it felt just like, for the person who had RFA treatment or any ablation, really, when they injected the anesthetic, local anesthetic into your neck, that burning sensation, exactly the same.
Oh, okay.
So yeah,
Okay.
exactly the same. And I remember taking the painkillers every 4 hours for 2 weeks, I think.
Um,
I think I could handle pain quite well. Well, it's not the worst pain of my life, I have to say. Bearable, completely bearable. But it's easier to take medication. That's not just to help me going through work, basically.
yeah.
Yeah, yeah.
This
And
is like week
then,
6 through 8 post-ablation, then that you're having this back
yes,
pain
yeah,
and you're taking medication
yeah,
about every
yeah.
4 hours. Okay.
Yeah, yeah. And then I kind of stopped when it's starting to leak
Okay.
the fluid, when it kind of popped, basically, the pocket. Um, Apart from that, I think it's just the night sweat that we mentioned because I didn't realize at first that's one of the symptoms until you mention it, that everybody's having it as well. So I thought it was just having too thick duvet for some reason. And
Yeah.
yeah, that's all really. Swelling, pressure, pain, burning sensation, and night sweats. That was my symptoms, the
And
main
did you
one.
get some redness on your neck too, like
Yes.
discoloration and swelling?
Yeah, yeah, yeah. It was red. And just before it ruptured, we can see the pockets of fluid starting to form,
Mm.
just like acne, really, just like blemish on your face when it's about to pop, and you can see liquid is forming up. And then when it's starting to leak, all the pain went away, stopped all medication. But still, because I was at the doctors at the hospital, they recommend me to take antibiotics
Okay.
even for 7 days, even though my blood showed no infections at all. I did just take precautions really, I was fine with it. And we stopped after 7 days.
Okay. So you had RFA about everything was progressing normally for about 6 weeks. And then
Mhm.
all of a sudden you got like a sharp pain. Were you doing anything? Like, because that's when you think you ruptured. And then it was 2 weeks
Yeah,
later then that it actually started
yeah.
moving.
It's really hard to say. one note I might note is that I coughed really hard just after we finished the treatment on
Mm.
the day. I started coughing when the doctor stopped. I coughed straight away, really hard. And but he scanned my neck again. He didn't spot anything out of usual. He just sent me home and that's it. So I don't think it was the cough, but maybe because I have my 2 year old baby with me and I was sleeping with him that night in a weird position, I think, uh, on the bean bath, basically. So my neck is kind of not properly, like, rest.
Mm.
Something, maybe that's it. And like, sometimes if you have young sh children, you couldn't help it. Sometimes they just hit your neck
Sure.
accidentally.
Of course.
Maybe it's combination of all of that during that week.
Okay.
Maybe. And second time around, my doctor had to use higher heat
Oh.
to ablate it because he said, "Oh, this is not unusually high, but like higher than he would have done to any other patients because um, as you do the treatment, this t treatment for the second time, well, in my case, anyway, the first time around, the nodule shrinks and then it's hardened. It's like solid rock hard thing. He was just like try to poke the needle through into my neck. I was just thinking, oh my God, please don't do it too hard because you might just poke it through the whole thing. But
Oh.
anyway, but to him, it's really hard to get the needle in. So, and then just to destroy the nodule again, he has to use higher heat, which can be one of the contributions
Yeah.
factor that caused the rupture. Maybe I don't know.
Okay.
Yeah,
So in your, if you had to guess, it could be maybe the heat had something to do with it, and then also
yeah,
maybe coughing. But it sounds like you didn't rupture until you didn't start having any symptoms until
yeah,
about 6 weeks afterwards. So it might be more
yeah,
likely that it was
yeah,
sleeping
yeah,
or discomfort or mom
yeah.
activity
It's
that you were strenuous on the neck, possibly.
really that. Yeah, maybe, but it's nothing too extreme that's
Yeah.
hit my neck during that week. I think it's just slightly rest my neck in a different position, like, yeah, to be
Okay.
honest, I'm not too sure
Yeah,
really.
that's okay.
Maybe combinations of everything. Because from the research that I read from Korea and some other countries I can remember, the some of the guys ruptured 6 months after. So it's much more delayed rupture. So I'm not too sure. Maybe the wall got weak at some point, and
Mhm.
then it's just like, because maybe it takes time for the walls to get the nodal walls to get weaker until it couldn't hold anymore.
Mm,
Maybe,
maybe.
maybe.
Okay.
Yeah.
So then going back to the timeline, so then when you're in the hospital, that's when it opened up, right? It was around that
Yes. Yeah.
time. So then it
Yeah.
opened up, and before that, you were on pain medications for the 2 weeks prior to it because it was
Yeah.
a lot more painful. Once it
Yeah.
opened, then what were the symptoms like after that?
Yeah. The pain was just, well, you still feel the pain from time to time, but the burning sensation is kind of gone
Mhm.
and much less pressure. And finally I can rest at night, like and then there's barely any pain now and then, but it's just my neck look scarier every week because it's got like how bruises developed. It becomes like pink red and then it becomes purpley and then looks a little bit like, oh, is this gonna heal?
Yeah.
And you wait and wait, but in times it gets better and better. In terms of pain, it's completely like I would say the worst one would be the first 2 weeks when
Yeah.
it ruptured, and then after the fluid starting to leak. In my case, it's just um easier road for me. Yeah.
Yeah. Yeah, I would agree with that too. So then once it started draining, then were you off pain medication after that? Did
Yeah,
you?
I stopped everything. Yeah.
Okay.
When it's starting to leak, I think I was still on antibiotics um until like 4 days after it leaks, I think. Yeah, that's it.
Okay. Okay. So then from then when it started to leak until when it closed, how long was that period of time, would you
I
say?
need to go back to my document now, sorry.
I,
I think it stopped leaking like 3 weeks ago, no fluid leaking. So it leaked on the 12th of April, I think, until the 28th of June. I can see it now. Yeah, 28th of June. That's when it stopped properly. Because sometimes it's just leaked and then the wound closed and then it's opening up again and then it's leaked a little bit more and then it's closed. But on the 28th of June, yeah, that's it. That's when it stopped completely.
so it was open for about 2.5 months then.
Yes,
Yeah.
yes.
Okay. And then when it opened up, I remember at first there was just one opening, but then you said there were several
Mm.
openings, right?
Oh,
So
yeah, yeah, yeah.
a few of them.
Yes. The first opening location is where the RFA needle went in. So
Mhm.
it's kind of it created some sort of track
Okay.
out of out of my skin, out of my neck skin, basically, which makes sense because that's where, like, where we make the puncture and it creates the own tracks to drain it. But then because I think it was still very swollen, so the skin feels like we've got a few pressure points, so to speak, basically, and it broke through those spots,
Got
which
it.
is not bad because the biggest wound I think it must be 2 3 millimeters. That's it.
Okay.
It's tiny. It's
Tiny.
very tiny,
Okay.
and so it's just fluids, which is pus like kind of. It looks like yeah, it looks infected, but actually it's not.
Yeah. That's what I
And
too.
yeah,
Yeah.
yeah, yeah. And apart from that, it's just tiny speckles of dry blood, which I guess is from the ablated area when it become the a clot, small clot of blood, basically, and that's it. No big chunks or anything like that.
Okay.
Um, yeah,
Yeah. And so that's interesting to note. So everybody that I've talked to thus far, the drainage that comes out, it almost like looks infected, but it's not. Like I think
yeah, yeah,
that's how the thyroid fluid or whatever it is
yeah, yeah, yeah,
draining
yeah.
looks. So yeah, that's good to know for a patient that if it looks infected, it still might not. I mean,
Mm,
you can still take precautions and get tested, et cetera. But
mm.
I'm wondering, would you feel comfortable showing us some of your images? You did such
Yeah,
a good job of
yeah, yeah, yeah,
documenting.
yeah,
I just think that
absolutely.
people maybe
Yeah, let me have an okay,
share your
share my
screen.
screen, send request.
There we go.
Okay.
So this is your spreadsheet. You did such a great job of
Okay. So,
documenting.
oh, thank you very much. So you can
Uh,
see my sheet, my spreadsheet now.
Not yet.
Oh, sorry. Okay.
Yeah, I
This
think
is
it's coming up now. Oh, amazing.
okay. I'm gonna zoom out.
Okay.
So because it's quite a long timeline. So I kind of basically this is for my doctor as well here in Ireland.
Oh,
Just for her to see my history. So this is just like, telling from the beginning what I have been having and what kind of treatments I had. And then approximately when I starting to feel symptoms and I kind of taking the pictures of the side and front views of my neck
mhm.
because the side view shows really good how swollen it gets really.
Yeah,
And the front view just to have it like, see how wide the inflamed area is.
yeah.
Um, so yeah, and right below, sometimes if I have the pictures of what's coming out of my neck, I would take it from time to time. And this description of the liquid as well, what it looks like, and so on. And then on the last row is just symptoms in general, how I felt that week, basically going through everything. I
Oh,
wouldn't mind if you, at the end, when I finish with this, I'm gonna send you and then we can post it online if
yeah,
you
that
like.
would be
Yeah,
fantastic. Yeah, and I would love to.
yeah.
I can even link it below this video on YouTube too, so people can see it if you feel comfortable with
Yeah,
that. But
yeah, 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 yeah,
yeah,
yeah, absolutely.
awesome.
Um,
Can you walk us through these pictures? These are so helpful. So if you can show us like what it kind of looked like before, and then when it was
yeah,
starting
yeah.
to
So,
open.
this is the first picture I've ever taken. So that's when I felt something's not quite right, when it's starting to swell and some pressure with no pain. That's the week that I went to ER the first time, and they told me we couldn't tell what's going on. Go home. Um, and then I kept track of everything until now. I need to, yeah, I even took picture when I was at the hospital. So I went to the hospital on the 9th of April.
Okay.
So that's when it becomes like red, and they saw my neck basically, and they said, "Oh, that looks infected." So they did all the tests, regular blood tests every day, and I have my results here as well, the CRP and so on, which is white blood cells count.
Okay.
So if you have higher than normal, it means you may have infection because your white blood cells trying to kill whatever that's foreign to your body, basically.
Hmm.
And then you can see now on the 10th of April, the pockets of fluid starting to form on
Yeah.
my neck.
Yeah.
And then the next day, it's popped basically, and
Mm.
it's leaking out. And yeah, I would just have to change the bandage 3 times a day during that time. And that's what it came out basically. So pus like mixed with blood. Um, yeah, and I kept track. Right then it still keep no, I wouldn't say it keeps uh getting bigger, but it just stayed that size, but gets more kind of darker red
Hmm.
the weeks after, and it's still leaking. Yeah, and I have the second picture as well. You can see small speckles of blood mixed within the pus-like fluid as well.
Hmm.
Then on the 21st of April, I started to see, oh, you see the blue arrow?
Okay.
That's the next spot that I feel like, oh, it might just pop again.
Okay.
But like the first time the liquid starting to leak, I felt like a burning sensation. It was really bad. But this time around, nothing at all. It just felt normal, really. No pain, no extra pain, even though the second spot is about to pop. And then I think the week after, you can see that spot is starting to leak now. And yeah, it's just getting darker, deeper red,
Uh-huh.
kind of. And then I think, yeah, it keeps going. And then I think right at this point, mid-May, it started to shrink a bit.
Okay.
Yeah, because yeah. As you can see, like it gets smaller,
Uh-huh.
but it gets darker and looks scary at the time.
Yeah. Did it
And
feel pillowy
Mhm.
too? Like if you were to put your
Oh
finger
yeah.
on it, did it
Yeah,
feel
yeah, it feels
shaky?
it feels softer. I
Yeah.
forgot to mention, yeah, thank you for saying that because when when before it leaked, it was really hard, like you couldn't really press on it.
Yeah.
But right now, like here when we stopped at 24th of May, yeah, it's really soft, like a soft tissue underneath the inflamed area.
Like it almost like did it feel like there was like a pocket of fluid underneath
Yes.
the
Yeah,
skin? Yeah.
exactly, exactly, exactly. And even then, I tried to express some of the liquid out. I couldn't get much out really, but I express it until it kind of stopped leaking on its own, and then I closed the bandage again.
Okay. Hmm.
Um, and then right then, I think I reduced the bandage change to 2 times a day,
Hmm.
and it was I think it's perfect because it gives body sometimes to collect the fluid and then start leaking again. Um, and then so yeah, it gets much smaller. 14th of June, still deep dark red, but it gets smaller as you can see. And then this is 5th of July, 12th. So yeah, my neck now looks something like this
That's
without the
amazing.
bandage.
Yeah. And look how
Yeah.
much smaller it is. You can tell on the picture on the top, like that the lump is just,
Mm.
it's flattened out now, which looks great.
Yeah, for the first time in since 2009, my neck looked normal. If you don't count the red area, but it's just completely flat, which
Yeah.
is I'm so happy about.
Hmm.
I'm gonna stop sharing now because
Okay.
that's the end. So yeah, it was I was so happy because like now well, I'm still wearing turtleneck because like I still have it,
Yeah.
but it is just completely flat and then I was just so pleased with it, basically how it looks. And then once this all healed, it would just look normal.
Yeah.
I still have like maybe 3.5 by 2 centimeters of the ablated nodule, which is tiny. You couldn't tell unless you touch it.
Okay.
But then the last time we had a scan, we found out that I have two more cysts, which is fine. I'm just going to drain them later. But
Okay.
it's just right underneath the inflamed area. So we
Um,
kind of wait until it's healed fully and then I'll go and drain it. So yeah, it's not a problem. So it'll be even smaller, my neck,
Yay.
which is nice. Because
Uh,
I like it was up to here, up to my how do you call this? Voice
yeah.
box.
Mhm.
Yeah, yeah. And it's just so right there, so obvious. Like, and
Yeah.
then now you can see at all. And my friend's like, wow, that's really a different.
Hmm.
It shows some difference. That's all. Yeah.
Yeah, yeah. And so walk me through how you handled the wound care, because I know we talked about that.
Mm.
I wanted to see. So I put together like a spreadsheet with a bunch of different materials and talk about what was helpful for me. And so I'm just curious to see what of that was helpful for you. Like what did you wind up doing? What was
Oh,
your
extremely. I,
strategy?
I followed all the products that you bought basically because I know you did the research.
Uh,
And even though some of them is not available in Ireland, I got it from Amazon US really, and then they shipped here. The bandage is really helpful. The silicone one, because you have to have the bandage 24/7 basically for however months long you have to do it. So in my case, it's 2 months and a half. So the silicone bandage is really soothing your skin is because I used to have the plasticky kind of, and then during the shower I use the waterproof one and it's really stick onto your skin. And when I peel it, it ended up ripping off the skin on the neck as well, which is not helping. And I use the pad, the liquid absorbent pad. What's the name?
Aquafel? Yeah.
Yeah, yeah, that's the one. Um, on top and then close the bandage. And then the wound wash, the blue bottle one, that
Gosh.
one's really good.
Hmm.
Yes, yes. So I use three of that really and nothing else.
Okay, perfect. Awesome. So that was helpful. And you just change the bandages as need.
Yeah, 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 yeah,
Yeah.
yeah.
And I find that the silicone is just such a game changer having silicone
Mm.
on your neck instead
Oh,
of
good.
the Band-Aid. You're absolutely right. Because
Yeah,
when you're changing the bandage every day and it's going on for like months, it rips at the skin. And so, yeah, silicone is amazing.
yeah, yeah. Oh, it's perfect. Yeah.
Mhm. Yeah.
Really good. Thank you so much once again for all the recommendations. It's
Oh, of
really
course.
good.
Yeah, I'm
Even
glad.
my doctor is like, wow, who is this Christina? Like, she was so helpful. And then I
Oh,
sent I sent my doctor your list as well. And
oh.
she's really, really pleased to see.
Oh, that's
Um,
so sweet.
yeah.
Mm. I love it when everybody's coming together, to find solutions and work together.
Yeah, yeah, yeah,
Collaborate.
yeah, yeah,
Awesome.
exactly.
Yeah, it sounds like you have really lovely doctors too, which
Oh,
makes
yeah.
such a difference. Yeah.
Oh, yeah, totally, completely.
Which leads me to my next question. Would you recommend your doctors? Because some people feel like, oh my gosh, my doctors did amazing, even though it was difficult. I wouldn't have
Mm.
chosen anybody else. And other people are like, oh,
Mm.
which doctors? So
You mean RFA doctor or my endocrinologist?
let's talk about both. Yeah.
Both.
So
Yes, highly.
highly
Any
both of
day,
them.
I would go back to them again.
Okay.
And starting with my RFA doctor, he's really, because the first time around it was over 8 centimeters. So he took time going through every spot just to make sure that every part got treated, basically.
Good.
So he's really, really good. And then just because we met a day before just to have a scan and talk through everything. And then he asked me anything. And so I asked him everything basically. And then he took time to just go through all my concerns, really.
Yeah. One of the
Yeah.
things I want to kind of highlight from your story is that it sounds like your RFA, you recommend both of them. Your RFA doctor was knowledgeable about ruptures, but your endocrinologist really didn't have any experience with
No.
ruptures, it sounds like.
Yeah.
But you'll recommend both of them. And I think that that's important for people to understand is that for me personally, it was less about how much did you know about ruptures and more about how
Mm,
are you caring about me as an
mm.
individual? Are you
Yes.
caring? Are you
Yes.
trying? Are
Yeah.
you listening to me? Are you
Mhm.
validating me?
Yeah. Yeah.
All
Yeah.
of those things. Because and I just think this is helpful for other people as maybe they only have one RFA doctor in their area, but that RFA doctor doesn't have a lot of experience with rupture, and they're wondering, should I go to them anyways if I'm concerned about rupture?
Mm, mm.
And well, first of all, rupture is it happens in such a small percentages of cases, but I think it's a great question. I think it's something that we should ask. So I think what we're kind of deciding together and what I would agree with you on is that it's less important how knowledgeable they are about rupture because it's going to be hard to find a doctor who's super knowledgeable about rupture. What's more important is their bedside manner, how they care for
Mm,
you, their communication afterwards. Are they willing to look into things for you and to work with you? I think for me, those are the more important things to look for in a physician. It's less about how experienced you. I mean, it's great if you find a physician that's experienced in rupture, awesome.
mm,
But I think
mm.
those are less likely. I think for me, it's more important for somebody to be really caring and compassionate and a problem solver and somebody that will really work with you. Would you agree on that?
Oh yeah, completely. And my endocrinologist ended up finding the same research from Korea that I found. I haven't sent it to her. She just did the research herself. It shows that she's really
Yeah,
cares and want to look after you.
yeah.
And so it's really, really good to have somebody who's that caring, like, and she's constantly like, ask me, or if you feel like, because we scheduled like a checkups every, as you know, now it's 3 months apart,
Mhm.
but before it's like each month. And she was just like, if you feel worse, just come in, doesn't matter. Because she's one of the highly recommended endocrinologists in Ireland. Her list is as long as miles away, but she put me at the front of the queue, knowing that I have the urgent case, like, so it's really, really good for her
Oh,
to do that. So yeah, I'm really grateful.
that's amazing. That's how it should be when we're having complications. So I'm so
Yeah,
grateful that
yeah,
she did that.
yeah,
That's
yeah,
amazing. Yeah, she sounds
yes.
like a wonderful doctor.
Yeah, oh, she's lovely.
Oh, and so, okay, so we've talked about the whole case, how it happened. Oh, the one thing we didn't discuss is the clinical setting. So when you actually had the RFA procedure, was it in a hospital? Was it an outpatient clinic? Like what did it look like? Where were you? What was the facility like?
Yeah, it's a outpatient clinic.
Okay.
So is it his practice? I think they've got like maybe 4 or 5 doctors. So it's very small and it's in this kind of medical community. You have different things to go to. You have dentists, you can go to bone doctor, you can go different other things, but it's not a whole big hospital. It's just an area where all the clinics kind of
Okay.
opened, really.
Okay.
Yeah.
Okay, so it was in an outpatient clinic. The other question I have for you is, sorry, I'm jumping all over the place.
No, no.
But the other one is, I just wanted to see from you how this impacted your life, like how having a rupture impacted you in all areas, whether it be like emotionally, mentally, like how you
Mm,
handled it, like how it affected you, how it affected your work life or family life,
yeah.
or even our finances. I mean,
Yeah,
buy all
yeah,
these different bandage stuff is not cheap.
yeah.
So,
No, no,
you
it's
know,
not. It's not.
so I
Yeah,
just wanted
but
to see how it all
um,
affected you.
yeah. So emotionally, it's been hard the first 2 weeks. That's it, of not knowing what's going on because
Mhm.
I wasn't sure myself if I have a rupture. But later on, as it becomes clear, I was like, okay, I have a rupture. I know what's going on because I feel like I've gone through many posts through the Jen's Facebooks. I kind of quite informed, and then I was introduced to you as well. So that's when I was put at ease, I say. So yeah, it emotionally struggling to deal with it the first 2 weeks, like when I was in the dark, basically. But apart from that, emotionally afterwards, it's like I forgot about it from time to time, like
Oh,
because
nice.
even though you have to change the bandage, but it just hardly affect your life
Hmm.
because you become a pro at changing bandage by the end of 2 weeks, really,
Yeah.
and then you just don't care about it. It's something you have to do, like brushing your teeth.
Yeah.
That's all. And in terms of work, I think I only took 2 days off work when I was at the hospital. But everybody at work was like, and my boss like, you shouldn't come back to work. And then I was like, no, no, this is really good distraction in a way because
Yeah.
I can work just fine. It's just my neck really that's swelling, swelling, and yeah, I think work for me is good to distract with like everything that's going on. Um, yeah, and I have to come to the fact that it just takes time. That's all, that you have to be patient about it. And it's not like every week you get better and better and better. Some days it might feel like, oh, it's getting slightly bigger, but then the next day it'll shrink down again. So
Mm.
it's not like so you have ups and downs, really. So not don't expect like, oh, it will get better from now on. The worst is behind you. So be prepared to be like, oh, this day is more swollen, but the next day it will shrink. But as a whole picture, it keeps shrinking, shrinking, but slowly, slow. So yeah, now that I gone through most part of it, I think.
Mhm. Yeah. And if you had to go back and do it again, like, I mean,
Mm,
hopefully this is it for you. You're going to drain those cysts and you'll be all done with this. But if it did grow or something happened again,
mm.
would you choose RFA again after this?
Yes, yes, absolutely. And because I have maybe two, three smaller ones, 2, 3 millimeters, tiny, tiny. So I'm waiting for them to grow. So if they grow any bigger and I want to get rid of it, definitely RFA again. Yeah.
Awesome. That's good to hear. And you'd recommend the physicians and the different
Oh
facilities.
yeah, he's very skilled. He's done thousands of case on his own, so he really knows what's going on and he's very professional about it.
And is there anything that you would want other thyroid rupture patients to know? Like anything that you've learned along this
Um,
that you wish that
oh,
other people knew?
uh, yeah. Well, it's just maybe because we will have the information on our website as well, how it progress itself, really. So just read that through and know your symptoms really and when to call for doctors if emergency cases happen. And one of the things that my RFA doctor recommends is do the hot compress. But I found myself that cold compress, I felt better with cold compress for some reason.
Mhm.
But I tried to take hotter shower and like splash it on my neck. I don't know how hot and cold helps, which one is better, but I feels for myself cold is good for me.
Yeah,
So yeah.
I noticed that too. And my first physician had said that cold compresses, that there were some studies out of Korea that had said lots of cold compresses. So I did that a lot and that
Mm,
helped me too. So that's interesting.
yeah, yeah, yeah.
Okay. And anything that you wish that that the doctors knew, any of the physicians, like if you could give them any insights, recommendations, what would you say to
Oh, um, I would say just try to listen to your patient as well, because sometimes I know that we're not like we didn't have medical degrees or anything like that, but it's our bodies and kind of we know how it feels and how it should be treated. If we say, I would like to observe this and wait, let's just do that. So I because rupture in most cases is not life-threatening. So yeah, I would just yeah listen to your patients basically and be informed about the like what's about to happen or the process of everything really and to recognize how it's happening as well and not misdiagnose it like And yeah, I think that's that because to avoid unnecessary treatments like scan and medications and so on, because like we've been discussing, it looks like infection, but it's not. So if it's not, it's not. No need to give medicines or anything like that. So yeah, it's good to just wait and see at the beginning and then moved on from there, I
Yeah,
think.
that's so helpful. Yeah. So we have talked about your whole journey and all
Yeah.
of your thoughts. I'm wondering if there's anything else that you can think of that we didn't cover that would be helpful for patients or physicians to hear about throughout this process. We didn't talk about the support group that we did or a lot of
Mm.
our
Oh
communication.
yeah.
And so, how did that help? Did that help at all to be in contact
Oh,
with other people?
yeah. It's really helped to talk to you after I posted to the group and Jen linked me to you. So it's very comforting to talk to you every day and tell you my symptoms because like I told again, I didn't know what to do. So to have you guide me, oh, this will happen. And don't worry if you feel like, when the wound is healing, you feel the stabbing like pain.
Yeah.
If
Hmm.
if you didn't tell me that, I would panic.
Mm,
But it's just now I know that it's trying to heal itself. That's why you felt that stabbing like pain. So I was like, okay, that's fine. So
yeah.
it's really good to have somebody who's gone through it several times in your case, and yeah, just to talk to the person who's experienced it before, it's really helping. So I would say support group really helps immensely.
Yeah. Yeah.
So would love to continue the if we have new cases, like it's nice to talk to us again, I think.
Yeah, I would love that if you could continue to
Mm.
be involved
Yeah.
as new patients are having these experiences. We can help kind of walk them through it and just reassure that, we've been through this, you're not alone. I think that that was the biggest thing for me going through it was just feeling like I was alone in it, not having any answers, nobody
Yeah.
to ask,
Yeah.
just,
Yeah.
being
Yeah.
in the dark. So I'm so glad that that was helpful.
Yeah.
We'll keep it
Yeah.
up.
Yes, we will. We will. Look, I didn't know how you get through all of that by yourself. It is just amazing what you've done for everybody, really.
Oh, thank you so much. Yeah. And thank you for contributing. You've done such an amazing job of documenting it too. I feel
My
like it's
pleasure.
going to be so helpful for other patients to be able to see your journey and all of the pictures and stuff. It's just, yeah, it's so helpful. So thank you so much for your time and
My pleasure. Anytime, anytime.
yeah, yeah. All right. Well, I'm sure we'll talk again soon. And, if people are wanting more information about Rupture, so you can go to thyroidrupture.com and we have the information for the support group. And hopefully, Anne will continue to join us in that support group and be available to answer more questions in that forum or whatnot. You can always reach out to me as well through the website. And yeah, thank you so much, Anne. I really appreciate your time.
Thank you. Thank you so much.
All right. Bye.